All right, listen to this. Michigan is reporting its first human case of West Nile virus this year, and it comes on the heels of a deadly case in California's Bay Area. It was the first West Nile-related death reported in Contra, Costa County since 2006. CBS News medical contributor Dr. Celine Gounder joins us now from New York City. She's also the editor-at-large for public health at KFF. Dr. Gounder, how does someone know if they've contracted West Nile virus exactly?
Well, the only way to know for sure is to get tested. But some of the common symptoms people will have are a lot of flu-like symptoms. So fever, they might feel achy, they might have a headache. With people who develop more severe versions of West Nile virus, they might have confusion, difficulty walking, other neurological symptoms that a lot of people associate with a stroke.
And considering some people show no symptoms, as we see here on the screen, who is most at risk for the most severe cases of West Nile?
So I think a lot of people will be familiar with the concept of asymptomatic infection. We saw a lot of that during COVID. So that's when you don't have symptoms. So not everybody who's infected goes on to have severe symptoms, but those who are at highest risk for developing the neurological symptoms in particular are the elderly, and then also people who have certain cancers or have had an organ transplant.
Now, if it's mosquitoes carrying these things, I would imagine your best active defense is to protect yourself from mosquitoes, but you're the doctor and expert. How specifically can people prevent themselves from getting this thing?
No, that's exactly right. One thing that does help us here in the United States versus other countries where you have mosquito-borne diseases is we tend to have better housing, screens on our windows, perhaps air conditioning. All of that helps reduce exposure to mosquitoes. But other things you can do is to wear insect repellent. If you're in an area where there is known transmission, whether it's West Nile virus or some other mosquito-borne disease, to wear long sleeves, long pants when you're outside. And then also if there's standing water near where you live or where you work, mosquitoes breed in standing water. It could be just the amount that's in a bottle cap, but really trying to get rid of any standing water where mosquitoes can breed.
Yeah, very important tips. Dr. Celine Gounder, thanks so much for joining us today.
My pleasure.